folks, I was able to compete. I was not only able to win the National Veterans Championship, but I went unscored on over a 3-day competition. And Dr. Spurgin, I personally want to thank you for that. You added another trophy to my case, and now I'd like to go into one of your examination rooms and talk about this pyramid of treatment, see some of the new equipment you've added here at Deserts Consultants, and it's exciting to be here in your new office.
Well, I have been going to chiropractors for over 20 years now with a variety of different problems. In my line of work, it's very physically demanding, and there's a lot of stress on my neck and my shoulders and my lower back. And Dr. Spurgin and his staff really allow me to keep doing my job, so I'm really appreciative for that.
Dr. Spurgin is a very good listener. His approach to my problem was to, of course, do x-rays and full examination, and he's very good about doing follow-up to ensure that the treatment that he's offering is working. And when there hasn't been enough improvement in a particular area, then he will change his treatment options until he starts seeing the kind of results that we both want.
He's very good. The thing that I appreciate most is that they're very flexible as far as when I can come in. When I know that I need to see them, I can pretty much call, and Lucy gets me right in for an adjustment, and I feel better immediately.
Dr. Spurgin has made it possible for me to enjoy some of the activities that were part of my life before my sports injury. He has allowed me to get through my day and do everything I need to do, focus on my work without having to think about pain in my knees. And I'm doing it without drugs, which is very important to me.
Well, as a personal chef, again, my job is very physically demanding. I'm carrying a lot of things in and out of people's homes, bags of groceries, heavy equipment. I always tend to have a frying pan in one hand and a whisk in the other, and I'm doing this. And so when my back goes out or my shoulder gets stiff or my neck is stiff, Dr. Spurgin is able to see me right away and clear up the problem and lets me get back to work. Usually if I call in the morning and just say that, I can come in the morning or I can come in the afternoon, Lucy's able to give me an appointment. And I come in, he sees me right away, and then I'm right back out and doing my job.
Dr. Spurgin, we've been talking about a lot of things today. We talked about your experience, your background, the fact that your father was a chiropractor, the fact that your son's a chiropractor, 3 generations of chiropractors. Dr. Finkel was very interesting to talk about. You've pointed out some really unique things about your treatments and things, but the one thing I really want to talk about is this thing you more or less invented called the triangle of treatment to health. Or tell me a little about this triangle approach to your treatments.
Well, the whole idea and focus of it is that you want to enter the triangle at the lowest level and keep yourself at the lowest level of treatment. You don't want to have a lot of diagnostic tests. You don't want to have a lot of procedures done. You don't want to have a lot of medicine. You don't want to end up with surgery. You want to start at a low level and get in.
When you say enter at some level, you're talking about someone that has no pain, someone has a lot of pain, somebody's had an injury. In other words, this triangle, at the top of the triangle would be surgery, the most undesirable position to be in.
Yes.
Down at the bottom, you have a little thing that's called the sooner the better.
The sooner you enter it, the better. If you have a pain, you have a fall, you have an auto accident, the sooner you find out what's gone on and the quicker you get proper conservative care, the better off you are. You want to have the history taken, have a consultation, have an examination, have what other tests you need in the beginning to find out what you have and whether you need care. And then you want that care to be at the lowest possible level in relationship to conservative care. You want chiropractic, manipulation, physiotherapy. You want soft tissue treatment. You want electrical therapy. You want ultrasound. You want education. You want all these things before you have to have more serious things.
So that would be at the bottom level of your triangle.
Correct.
And as we go up, we find that patients are responding or they're not responding. What's the next level?
Well, the next level is more of the same of the first with a little added things. You have over-the-counter medication. You have workplace modification. You have physical therapy. You have education. You have massage, nutrition, behavior modification. In other words, what are you doing that may be causing it? You have more stretching, more exercises. That's the next level. We're still in conservative care. And then the next level is getting into more types of invasive procedures now.
You mean if someone is having lower back problems, and let's say they're driving a lot, they're a truck driver or they're a long-distance driver, and they come to you and say, gee, I don't know why my lower back hurts. So as you analyze them and find out that they drive a lot, that they're sitting a lot, that helps you diagnose and give a treatment.
Yeah, you first want to see how well you can get rid of the pain and how well you can control the pain. And then you want to train the person on what they can do, either modification of the car seat, the truck seat, or exercises that they do before they drive every day or after they drive.
And you get involved in
all
all
these
of
kind
that.
of things. Yes.
Very good.
And you want to keep it at that level because that's the level that has almost no side effects. If it works, great. If it doesn't work, it's not going to cause other things. The next level, you're starting to get into things that now are slightly invasive. They're not much invasive, but they're slightly invasive. And that's more like prescription medication. Prescription medication is great, but you don't want to take it the rest of your life because it has so many side effects. So the same thing is we have it when we need it. The same way with injections or distraction therapy. Well, distraction therapy is not for everybody because you first need to have all the diagnostic procedures. You need to have an MRI or a CAT scan or an EMG or vascular studies, all these things before you do distractional therapy. And distractional therapy is not for everybody. With pain management, you can have facet injections or you can have epidural injections and you can have all kinds of things like that. Or you may need to have rehabilitation type procedures where you're rehabilitating yourself. Well, all those mean that it's gone past the point of using the lowest level of conservative care. And we want to use that restrictive. We don't want to use that all the time. Like medication. Medication is wonderful, what they do.
Give me an idea.
But you don't want to use it all the time.
Give me an idea of medication. Now,
well,
when somebody's in pain, would that be like a Ativan, or would that be something more prescribed?
No, something. If on the lower level is the over-the-counter medication, and that's what you buy in the drugstore without a prescription. Those things have little or no side effects, so taking those is not a big deal. So I lower that. That's on the lower end of the scale.
Something like Vicodin.
Then you're getting prescription. And when you're getting prescription, they're wonderful drugs, but they're not made for chronic, permanent use.
They don't cure anything.
Well, what they do is they cause side effects. They can damage the liver.